Join us every Wednesday for InFocus, a weekly talk show produced by the SKNIS Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.
I'm Ian Richards, welcoming you to InFocus, a weekly program where we take a close look at what's happening within and across the government of St. Kitts and Nevis, your government. On today's program, we are examining ongoing efforts to transform healthcare in St. Kitts and Nevis. Our discussion will include the bold steps being taken by the government to construct a modern and sustainable smart hospital, a facility, state-of-the-art facility in fact, designed to combine the latest technology and innovative patient care practices. We'll also look at the current essential staff training currently taking place that's shaping a stronger, more efficient healthcare workforce. Joining us for this conversation are Curtis Morton, Permanent Secretary in the Ministry of Health, and Dr. Jenson Morton, Director of Health Institutions in the Ministry of Health. Stay with us for InFocus, your government, your business.
Upon taking this office of Acting Permanent Secretary of the Ministry of Health, I was asked by the esteemed Honorable Prime Minister and Minister of Health to do two things. One was to stabilize the Ministry of Health, and the second was to transform the Ministry of Health. And when I speak of the Ministry of Health, I do not speak of an edifice, I do not speak of a building, I speak of the landscape of healthcare in St. Kitts and Nevis.
Welcome back to InFocus, and will allow me now to welcome to our program Dr. Jenson Morton and Curtis Morton, Permanent Secretary in the Ministry of Health. Of course, Dr. Morton, you are no stranger. Dr. P.S. Martin, I told you that was going to happen. It's a first time here, and we're glad to have you.
Yes, I'm delighted to be here.
All right. So let's jump right into it, P.S. And persons looking at the screen, looking at the program live, whether it be on television or on social media, they would have seen that you were appointed back in April in 2024, last year. Now, what would you say were your top 3 priorities coming into the job, and have you been able to achieve them?
Yes, thank you very much for that. First of all, allow me though to express my thanks, my fervent thanks to the staff of the Ministry of Health who come out every day to bat in defense of providing healthcare service to our people. They make tremendous sacrifices, and I want to compliment them highly. Well, the role of the Permanent Secretary is a creature of the Constitution, Section 61, and in a sense, to keep the ministry's assets, people, and things in good working order. And so, when I came in, there was a need for the ministry's work to be looked at closely. The Honorable Prime Minister and Minister of Health, Dr. Terence Drew, had asked me to begin the process of stabilizing the ministry, its finances, its resources, human resources, and also to begin a transformation journey, which we have started. And so the question one would ask is, why? Why change? Well, by August 2022, the health sector or the healthcare landscape were dominated by some imperatives. In terms of maximum responsiveness to people's care was in fact an election promise that the administration was elected on. It was the number one matter on the voters' mind. And so the sustainability of healthcare, financing and workforce numbers and competencies also fell in line with the country's national strategic plan, which is a sustainable island state. And so we had to focus on building some resilience and the ability to maintain essential services in the face of inevitable shocks, such as hurricanes, economic downturns, and the surge demand for services in terms of epidemics and mass casualty. There were some principal game changers. The healthcare systems were challenged by a number of things. One was the post-pandemic recovery and reset, new emerging and re-emerging infectious pandemic potential, health effects of climate crisis, rising antimicrobial resistance, rising levels of chronic diseases such as cancer, obesity, stroke, diabetes, end-stage renal failure, mental illnesses, and post-traumatic stress disorders, depression, addictions, and so forth. The unsustainability of expenditure focus on sickness care needed some attention as well, so we took a closer look at that. Upon coming in, I also reorganized the leadership focus. We extended the leadership team, and I can tell you we have a dynamic leadership team working day in, day out. For example, the work that you would have seen at on the new hospital unveiling was some tremendous work that had gone in by very good officers such as Dr. Jenson Morton. And even now, we continue to work steadfastly to ensure that we bring that home to the people of St. Kitts and Nevis. And so we want to make sure that as well, that the matter of healthcare is actually people's business, and it's too big to fail. It's something that affects every one of us, and we want to make sure that people in healthcare, that they truly care. So that's why I started out by thanking the staff for the work that they have done. We also want to ensure that wherever there are pockets of people not holding their end of the bargain, that we're able to step up and be the game changers that it is. I think we're on a good path, and so we want to increase compliance in terms of the way people are treated. We have looked during 2024, we spent quite a bit of time focusing on the plant, the equipment,
and when you say the plant, you're talking about the physical
infrastructure? The physical infrastructure,
right, okay.
The types of machines, the offerings, and so forth. And Dr. Morton will speak more about those in the clinical offering. But we're able to also deal with reorganizing the human capacity to ensure that we have the right fit in the right places. Because once you have that, and then, so last year was about that really, stabilization and the transformation. And then this year is really about customer service, patient service, and not even patient service, but patient service experience, because service is outward looking, experience is inward looking, and we want to make sure that when people walk away, that they can in fact say that they would have had a good experience. So we have pockets of where we need to improve. We see about 29,000 people at JNF annually. Mm-hmm. So that tells you the foot traffic and the footprints. So JNF has a lot of good stories. Despite now and again you hear some negative in the news and elsewhere, we can tell that there are a lot of good stories, and we have very good, competent people. Anytime we bring in experts and specialists to look at our healthcare services, one of the things I always say is you have some competent staff. So there's no shortage of talent in the Ministry of Health. And so we want to continue along that line. But
those are the stories really that people don't really hear, because as you mentioned, we tend to focus as a people on things that are negative. They don't hear the good stuff that's coming out of JNF. And so that story really has to be told. Is there a strategy to help to tell that story so that persons are aware?
Of course. Well, actually, I'm glad that you asked that, because when I came, the Health Promotions Unit were doing their promotions based on silo sort of promotions. So you have NCDs, you have HIV, you have nutrition, and so forth. But there are so many stories to be told. And part of the storytelling is the engagement of the public, ensuring that the public understand what services we provide. For example, I had a conversation with a young lady who had a child at JNF, and I asked her, well, she was complaining about the time waiting. And I said, well, what's the issue? And when you listen to her, it's really a service that could have been provided at one of the 11 health centers around the country. And so I asked her if she knew. She said, well, I'm not sure that there is a doctor, and secondly, I'm not sure what they offer. So you have to listen with understanding, and in listening, it meant that we have to go back to the drawing board and ensure that not only the services are known, that we provide the resources that they're there, and we also make sure that the community is part of the process, so we go out. Sometimes we have as well promotions that is pitched and put together internally for export in the community without involving the community. So we want to change that. We want to go where they are and do that. So we have been in the schools recently. We have been in the various communities, and we continue to build that out. And of course, right now as we speak, there is a meeting going on for a focus group dealing with customer service experience. And that you'll see things, for example, where we will uplift the service experience at JNF. For example, we'll have a help desk, a concierge at the front. And in the triage area, instead of just coming and sit down and wait on the triage officers, we'd want to make sure there's another person there that can actually deal with that interface.
Okay,
Yeah.
all right. Dr. Morton, let me bring you in now because, of course, I appreciate that you are the director of health institutions.
Yeah.
There is a director that handles community health
Yes.
and stuff. But
Yes.
just to answer the question that PS, and I'm going to start to call you PS, I'm just going to leave it there, I won't even mention
Thank you.
But the PS mentioned...
You can speak
in
doctor into existence.
All
Yeah,
right.
that's fine.
in terms of, is there a doctor at the facility? He mentions that the patient was concerned that there may not be a doctor there. Are there doctors at the health centers?
Yes, the health center framework is set up such that each health center is covered by a specific district medical officer. And I think a lot of times people have the misconception into thinking that that doctor is only available on the clinic day. So the doctor has a specific clinic day. It's either once a week or sometimes twice a week, depending on the population of the area. But that doctor actually is also the one responsible for anything that comes through the clinic Monday to Friday, 8 to 4. So as long as the clinic is open, that district medical officer can be called in by the nurse depending on the complaint. It's either they're called in or the nurse can call to get advice from the doctor, or the doctor, like I said, would have to come in, or if it's serious, to get the instruction from the doctor to pass it on to whichever higher health facility, and the doctor could also coordinate with the physicians in the emergency room just in case there's some additional information about the patient that that doctor might know since they deal with them more, since it's a DMO, that could assist in the patient's care. So sometimes, like I said, people would think the clinic day is Monday, so I have an issue on Tuesday. That means that I can't go to the health center because the doctor is not there. No, the doctor is always on call. We are actually trying to move towards improving the actual physical presence of the doctor in the health centers. That's a much longer term plan. That's more under the control of Dr. Iles, that's the Director of Community Health, but it's a longer term plan to do two things. One is to expand the opening hours of the health centers to 7 a.m. to 7 p.m. And the other one is to try to ensure that a doctor is always present. The pilot for that is actually going to be at St. Peter's. That's why if you look at how the new St. Peter's Health Center is being advertised, you're not seeing health centers in polyclinic. Mm-hmm. That's because we want it to be basically an interim between the hospital that we know as well as the health center that we know, with more services, more availability of the physician, longer opening hours, and just more to offer when you compare it to what traditionally would come from the health centers in terms of all of those other fields. And with the success of that, we can then see how we can move it through the rest of the country. 3 areas were already earmarked as being high population areas that would be good for that. The other 2 were Bastia and Newtown, but with the Bastia Health Center, that one more so will probably wait until we move from the current JNF to the new facility, such that the expanded services can be offered at the current facility to do a kind of mix of the 2 actions. And then after those, the next area that probably be focused on would probably be Keon, and then we'll continue. Sandy Point has the benefit of the hospital and health center in the same building. Right. So that's the other big population area, but they already have a little advantage. So bit by bit, we'll do that expansion out to try to see how we can offer more to the general public.
Okay, so as we mentioned, of course, the PS is relatively new. It's almost a year coming up.
He's actually been a member of the health team for a while. He was an advisor to the Office of the Prime Minister, and he also used to, since health is one of the Prime Minister's ministries, he also was involved a little bit more indirectly, but we are used to Mr. Martin assisting us in health, even before he became PS.
So essentially it was a seamless transition then. Can you talk to us about any noticeable changes that has happened since he assumed the role as PS?
There have been plenty noticeable changes. One good thing about, if PS Martin doesn't mind me complimenting him,
that's fine.
One good thing about PS Martin is his leadership style is something that was very much needed in health. Health is, it's a unique ministry in multiple ways. It's the biggest ministry in terms of the total number of people that are employed in it. And then within it, the entity that actually has the most employees in one spot in the whole government system is JNF Hospital. So those two things are important. The other thing is that health has the most persons that are professionals, like trained, certified, multiple degrees, etc., more than any other ministry. So even ministries with a lot of other people, they don't have that many persons that have those levels of qualifications. And of course, health deals with life and death, so it's very important. When you can prevent it, it's great, but when something serious happens, you also need to have the ability to respond to an emergency. So because of that, health is very difficult. So whomsoever is the accounting officer for health, they have to have a very good mix of skills. With Mr. Martin, his background in human resources, it's human resources and customer service. It's actually very good because that was one of the areas that we needed some strong assistance within health. Even though, as Mr. Martin would have pointed out, experts would have said over and over again that we have staff that has a high level of competency. If it's one area that we used to get a lot of licks for, it was just aspects of customer service, things like answering a phone, speaking with someone, how you put your face, the words that you use. You'd be surprised the amount of times up in the hospital when the doctor or the nurse, they did nothing wrong. Like what they did, the advice they gave, it was absolutely perfect. And sometimes it's the tone, it's the way in which it was said. It was if you went the extra mile to just give a few more words to explain. As Mr. Martin would have said, if somebody goes to the hospital, for example, for something like a pressure check, the truth is that the hospital in the emergency room, it's an emergency room. So things like accidents and heart attack in the back, and the staff could be occupied. If all that you came for is a pressure check and it's between the hours of 8 to 4, just down the road is a health center that really could give you the pressure check. So if someone goes to you and says something like, well, something like that you could get in the health center, you have to be very careful with how you say it because the person can take away from that. You're running them, like I went to the hospital and they run me, they didn't even want to do this, but you have to go the extra mile. You have to explain to them and say, we are very busy right now. If you choose to stay, it's going to take quite some time, but you'll get seen much faster. If you go to the health center, they can give you all of the help you need. Sometimes that is not done. Mr. Martin in particular, he has been going through all of the parts of the staff to make sure that everyone understands the importance of service and the quality of service. And that bridged a major gap, and it's already being felt because the general public, those that choose to be honest, sometimes people cling to the negative, but those that choose to be honest, they're already admitting that the quality of service that they've been getting has been increasing. That's one thing. The other thing is that as a leadership team in health, because it's multiple persons, since it's so big, we come together every single week, we meet every single week, all of the important information is exchanged simply because we are scattered in so many different areas. We have to make sure that every single week we meet so that everybody's aware of everything, so that all of the information is known by everyone, so that nobody's surprised by anything. And all of the heads come together as much as possible to make the best decisions. And Mr. Martin being the one at the helm, it helps because I would be honest, if it were up to us, we would always claim that we are too busy. But Mr. Martin is the one that insists every single week, no matter what, rain or shine, unless if something's super major, we can push it back.
Even when I'm aware.
There you go. Yeah. So we always have those meetings, and that has helped with regards to the end product that people will just see is better organization and just a better overall delivery of care, but all of these things come in it. And of course, the final thing with Mr. Martin is his exposure to the private sector. It's helped us in two ways. For one, the links with the private sector, it's really helped us with regards to, I don't want to say donations just like that, but yeah. It's helped us with regard partnerships. That's the term. It's helped us with regards to making professional partnerships with different corporate entities, and it has helped us to just strengthen everything that we have in various areas, such that the overall strain isn't 100% borne by the government, and at the same time, those corporate entities can enjoy, giving back, enjoy the act of giving back, and. I'll have to admit that the private sector, the demands that they tend to have, it tends to be a little bit harsher than that of the government. I'm trying not to say it in any other way. But when someone comes from the private sector and, the entire government entity, if they could pull that government entity up to the standard of the private sector, it helps. Simply because the private sector is profit-driven, so you have to do these things properly. The government, people tend to pretend like the government is this unlimited well of money, and you could be a little bit more relaxed. But, if somebody can help them to pull up the socks properly, it helps. And Mr. Martin has been doing that. So all of those things.
Right, and so PS, I imagine that is where you mentioned your mandate to stabilize and to transform.
Yes.
And that would include also forming those critical partnerships that can help to raise the standard of quality healthcare because, of course, as Dr. Morton mentioned, government can't do it alone, and partnerships are important.
Yes, indeed. And we would have had companies such as the cable who has come on board. You have seen the work at the fire. They were responsible for coordinating that. Ms. Pat Walters, who is the general manager, CEO, she has helped us. We have had Ram's group of companies. They have come forward to assist us with equipment to do with the eye clinic. We have had a number of other institutions. We have had the Joy Project will be coming in to deal with the pediatric ward with some toys and play equipment and so forth. And any other thing, and some learning devices. Right. So we are because it's about polarity. In this case, we are not doing either or. So it's not the old JNF versus the new JNF. We will be using both facilities, and where possible, we'll make sure that we use them to the benefit of the people, the citizens and residents of St. Kitts and Nevis.
What would you say, and Dr. Morton, I imagine this is where you would have a lot, well, some to say, of course, we're mindful of the clock, but in terms of the standard of the current state of healthcare in St. Kitts and Nevis.
The current state of healthcare in St. Kitts and Nevis is actually pretty good. The thing that people have to be aware of is a few things. Excuse me. One is, as the PS would have alluded to, in the emergency room area alone, we see 29,000 persons every single year. And if you break down the other areas, we do, excuse me, we do 40,000 unique lab tests every single year, 9,000 x-rays, 2,300 ultrasounds, the list goes on and on. Usually about 4,000 persons are admitted/discharged every single year. And amongst all of these high numbers, you'd be surprised how the 1 or 2 bad incidents a month are the only things that people speak of. And when you try to say, well, in the same month, we saw like 3,000 people, 2,000 to 3,000 people without any incident. So that goes to just let people see the evidence for themselves that the quality of healthcare had to be good. Otherwise, the numbers of these complaints would be a lot higher than what you're seeing. It's natural for people to complain. Nothing is going to be perfect for anyone. It's a public entity, so persons would. It's a public entity, and healthcare is something that's so valuable to people that the slightest slight, you will complain about it more so than anything else.
And so very personal as well,
it's
too.
Also, yes, you're correct. It's also personal. So you would go to the bank and get bad service, and you might brush it off. But if you get a similar quality of service in the hospital, you're not going to brush it off. You're going to curse for days upon days. That's just the nature of it. So with that backdrop, I would like to say the quality of healthcare here is actually very good. Our health budget with regards to the immediate needs that we have, it's very good. The best evidence of that is when we procure items for our health institutions and our health centers. We procure them not in a vacuum, but with the entirety of the OECS, because if we were to buy everything on our own, since we're so small, the fees would be super high, and in some instances, you'd be surprised that the people that do not supply beneath a particular number. So COVID time, I'm sure you'd have seen that in some instances, the places said they don't give less than 100,000 vaccinations in a thing, so we had to team up with other islands. So because we're part of that pool, every time we're going to be buying medication and different things, all of the islands have to chip in to pay their part of the order that they're making. It's nearly never that if there's an issue with payment, that St. Kitts is the issue. It's usually some other island. And they know this because they tell us this all the time. And that just lets you know that in terms of the support coming from the government to ensure that we have the resources that we need, it's there. The government itself would have invested in quite a number of state-of-the-art instruments, to the point that with the new hospital, which I know we'll speak about later, but with the new hospital, a significant chunk of the budget was, in the beginning, blindly assigned to equipment. But when the experts came and actually looked at our facility, they actually said that the equipment in our facility is so state-of-the-art that we could actually drastically reduce that budget, because so many things are so good, they're already state-of-the-art. They just need to be put in the state-of-the-art building now. So it's just to pass it over. That just lets you know that the investments are taking root and they're able to be seen. So it's not perfect. Medicine is a practice, so it's always something that you're trying to continuously develop.
Sure, yes.
But we have been making systematic steps to improve on everything, even though, in my opinion and in our opinion, the state of healthcare is actually very solid, and that the general public can rest assured that competent people and competent systems are in place to make sure that you are in your optimum state of health.
Anything to add, Mr. Martin?
Well, just to add that part of our effort to deal with the transformation journey is about the strategic leadership that I spoke about, clinical excellence and operational excellence, and of course, making sure that we have good financial health. And one of the things that I also would like to say is that for us at the Ministry of Health, we also welcome the private sector's investment in healthcare. Because, for example, if you take our brand new 128 slice CT scan machine, which is state-of-the-art, at the moment, it's not offered to the public. It will be soon.
10 days.
But in 10 days, right. But the private sector is providing that in the meantime. So we must have the redundancies to make sure that we coexist. And of course, the services provided by the government is always below par what the private sector is, because that's understandable, because people pay their taxes and they expect to have some return on these things, and healthcare is a big one for us.
Right.
Yes.
You mentioned that the CT scan service will be available in 10 days. Why the delay? Or is it part of the setup? Or what's happening there?
No, it's a part of the setup. It's multiple things. Apart from the machine going in, there is the programming that has to be done, and then the staff has to be, all of the staff has to be trained such that no matter who is working at whatever hour, everyone understands the ins and outs of everything of the machine. Apart from that, it's not just a normal CT scan machine, it's a CT scan machine that has contrast, the ability to use something called contrast. That's a separate setup adjacent to the machine that also needs its own training. So because it needed that much training for that many staff members, we're just erring on the side of caution to ensure that everything is in place and that we can launch seamlessly when it's time to launch, so that the service cannot be interrupted.
Right. And of course, Pierce, that is where you come in terms of training as well, to ensuring, because of course you have a background, as we established earlier, in training and ensuring that the staff is properly trained to have the opportunities to learn whatever they need to learn.
Correct.
So that the standards of healthcare can be offered. And it's not just necessarily with the CT scan. Of course, you would have seen that there was an accident and emergency training recently done there.
Well, coincidentally, I did a presentation this morning on customer service, a segment, about 8:30 this morning. In fact, they asked me to come back. So I told them that I will. You see, the old psychological contract of work used to be, I work for you, you pay me. That has changed to I work for you, pay me, plus I want other things. I want uniforms, I want pension, I want all these things. But on the other side, the employers are asking for greater efficiency, greater productivity. And so people should be engaged. After all, we choose where we want to work. And so when they show up to work, we should be in a position to serve people. And as I've said to the staff, that in healthcare, there's a particular reason why somebody thought in their wisdom to coin the words healthcare, to actually join them together in marriage. And so I always say, if you're not interested in healthcare, then you should basically find something else to do, because we cannot play around with the lives of people. It is that simple. Any one of us can be on that hospital bed, and we'd like to make sure that we're treated a certain way with respect. And so for our service, for our training, we want to start with the staff development, because service is an inward reach and an outward stretch. It's holistic. You can't just send someone to a training class and say, customer service, and say, that's it. If you're not monitoring it, if you're not being picky about it, if you're not measuring it. So part of our measurement and part of our thing going forward will be to have things like mystery shoppers. We're going to have people who do exit surveys, patients who are served that they can actually, and we have name tags that's going on. We're looking at refurbishing. We just done the orderlies in new uniform. And that was really exciting because they were involved in planning their uniform. And to the point where when we were taking the picture in the morning, the last orderly to come in the picture was actually running, coming to the hospital gate with the shoes, brand new shoes on his arm. Wait for me, wait for me. The enthusiasm. And I reminded them after the picture that, hey, I'm giving you a symbolic gift. And it's a clean piece of paper, which means a fresh start. And so customer service is key for us, but we must also look at the development of the staff. There are lots of things that bother people. There are people in the system who are stuck because they don't have the English, they don't have the maths. The Ministry of Health will be looking at that. We have already started a conversation with the Ministry of Education, through PSP Stana, to make sure that we help these people along. Because if you feel good about yourself, then you're going to give that thing. So we're working on that. We're also looking at how we can look at the specific training. Just recently we had Dr. Maloney, a daughter of the soil, right, who came in, who volunteered and came in with a team of A&E specialists. Because with healthcare, we are not taking chances with just making up as we go. No. Where they're specialists for specific areas, we bring them in and we get their specialty.
Especially if they're in the diaspora.
Especially if they're in the diaspora. And there are lots of people out there who want to help us, and we are examining. So human resource training, continuous medical education. There's been a gap between the old style of nursing, the old style of doctoring, and then you hear the argument, well, the young one's not listening, or you still need that grandfathering. So the continuous medical education is an area that the Honorable Prime Minister has insisted that we do. Leadership development, team dynamics, and of course, to make sure that all in all that we pay attention to wherever gaps are in the whole performance plans and the performance capabilities of the staff. Of course, we have looked at the commitment of the staff. It's the 3 C's, commitment, competence, and chemistry. So we want to make sure that those 3 things are gelling, and that's what we're working towards in our training. So each person in the Ministry of Health must be exposed to at least 1 piece of training every year as part of their development in the ministry.
Yeah. A very ambitious goal, and I think something that is...
Done, you know. It's not
we started already.
It's already started.
Started already. So. Yeah, started already.
So the feedback from the staff, have they bought into this new strategy?
Yeah, you can tell based on what Mr. Martin was saying, even with the new uniforms and the level of excitement, they have been buying into the strategy. You'll always have 1 or 2 persons that kind of got comfortable with the old way of doing things, even if it wasn't at the end of the day beneficial towards the patient. Those persons, they would always give a bit of trouble because, as I mentioned, with the word comfort, they thrive in chaos. They liked how things were, or they were profiting off the chaos, however it was. But bit by bit, 2 things have been happening. The person's genuinely interested in healthcare. They've been understanding, and they've been following through. Sometimes, surprisingly, like you would swear that this person would give trouble forever, and they actually say, they understand and they follow through. Or the other end of it is that if they insist on not doing what is best for the patients, they have been seeing themselves out. It's not the best thing to mention. It's just when you set up a system such that you're going to be held responsible and you have to deliver a particular quality of care, if you really are that comfortable with not being able to do so.
Let me also add that upon joining the ministry back last year, one of the very first acts I did, I used the funnel technique. So I actually went to every single group of employees, and I sat at least 2.5 hours with each of them to go through their needs, what are they doing well, what are they not doing so well. We're able to close some low-hanging fruits because you have to gain confidence. People have to see that you're not just bringing them together for a talk shop. You're bringing them together to actually bring results. And so we're able to deliver. For example, right now, we didn't have all the health centers with AC units. We do have that. On the St. Peter's Health Center, we now have hot water. That was never in the building. We had some long-standing issues that we had to sort out. But once you have systems in place, so my system is very simple, where you have my leadership team, generally, then you have the 2 areas, the community and the institution. They also have weekly meetings, which I attend. So look specifically at those areas. And we have an HR function, we have a finance function, officers who deals with that. And also, I would have met quite a bit of personal issues to do with people in terms of compensation, appointments, and different things. And we have ironed out a wash of that in very sharp time. Last point on that. My system since then coming in is very simple. During the daytime, I have meetings. Before I leave, every day, I sign off every single piece of physical mail. So if you come to me tomorrow and say, well, I sent something yesterday, it's not there. I dealt with that already. In the evening, I cleared all my emails, and in the day, I have my meetings. If you don't have a proper system in place, then it will not happen. And then the last thing is that is making people accountable. At the end of the day, when it comes to the hospital, Dr. Morton, he is accountable to me, and I am accountable to the Minister, the Honorable Minister of Health, to ensure that things are done. So that's why we keep them to the fire. And in the community side, you have Dr. Isles, who deals with that. And then for the Chief Technical Officer for the ministry, Dr. Hazel Laws, the CMO, she deals with policy and the partnership with the World Health Organization, PAHO, and the likes, CAFA, and so forth. So we have a system, and it's all coming together nicely. All right, so that is where we are at the moment.
Okay,
Yeah.
Very comprehensive. We're going to have to take our first break because there's just about 23 minutes left in the program.
Already?
But before we go, I told you time.
No, you must have us back.
Of course, absolutely. But before we go for our first break, and when we come back, of course, we want to speak about the new hospital, so we dedicate the rest of the time towards that.
Excellent.
But we want to talk about, if you just give us a quick update, Dr. Morton, about the MRI facility. How is that coming along?
It's actually coming along pretty well. The end date, or the target end date for the construction part of it would be in April, and the end date for the installation of the machinery would be by about June, but it's going to be in June.
Okay.
So,
and the staff is being trained currently, PS, or will that be done after?
Two things. One, there's going to be a specific MRI technician. So that person was already earmarked, and that person will be made available. But apart from that person, all of the radiography staff that we have, as well as all of the radiology staff, they will be trained on the machine, which was part of the package that included the purchase. So in the end part, that's why it's 2 months. The actual installation is probably going to be a month. But the end part is ensuring that everyone that's going to be dealing with the machine, that they get all of the fine-tuned training for that specific piece of equipment that they need.
It's essentially the same process as a CT scan.
Essentially.
They have to be trained. Everyone has to be trained. They have to understand.
Everyone has to be. Even though for this one, for the MRI one, like I said, there will be a specific tech, because the MRI is not like, CT scan is something that's needed 24 hours a day because of emergencies. MRIs are more like booked. So MRI is like an 8 to 4 booking kind of procedure. So you can earmark someone and put them there. You still have to have the freedom to know that if anything happens to that person, all of the radiographers can operate this machine. So that person is free to be ill if they, I shouldn't say free to be ill, but if that person is ill, the system isn't crippled, that person can go on vacation, and the list goes on and on. So everyone has to be able to work it. But I have to also state that we are going to be investing in our PAC system soon, which is a specific system for the storage of high-quality images that radiology uses. With that system being up, we have the advantage of not limiting the analysis of the images just to persons in St. Kitts and Nevis. It allows us to export these imagery to whomsoever we would have contracted or made an arrangement with, such that they can give it a second viewing. So if we, for example, get someone that gets a, let's say they have a brain tumor or something, it's not just our staff in St. Kitts that will deal with it. You can also pass on that information to persons that probably would be hyper-focused on dealing with brain alone for many, many years, and they see thousands a year, that little advantage, that person can give it a second pass or a second overview. The MRI is going to have that setup, but the CT scan will also have that setup. And the PACs would also help with like ultrasound and stuff, but that's local. That's to help the local doctor. But for those complicated ones, it makes sure that we're not alone. That's all.
Okay. All right. So as mentioned, we're going to take our first break, and it actually will be our final break as well, too, because there's so much that we have to cover still. And so persons who are looking at this, they'll be able to see some designs of the new JNF hospital that is coming. So stay right there, viewers and listeners. We'll be right back with more In Focus.
Thank you.
Welcome back to InFocus, and we are having a conversation with the Permanent Secretary in the Ministry of Health, Curtis Morton, and also the Director of Health Institutions within the Ministry of Health, Dr. Jenson Morton. All right, let's talk quickly about the new state-of-the-art hospital that's coming in, and I think I can probably say that this is part one of our program, because clearly there has to be follow-up. There's so much more to cover. Talk to us about the key features, Dr. Morton, quickly, in terms of some of the key features that stands out in terms of the new hospital that makes it an example of modernity and sustainability.
Surely. With regards to the aspects and features for the modernity part and for the patient comfort part and patient services part, the new hospital, one of the things it's going to feature is a maximum amount of individual rooms. Excuse me. So one of the issues that we currently have at the JNF hospital, even if we try our best, just the fact that there are certain areas in which 4 people or 5 or 6 people share a unit, it's not the best in terms of patient privacy and other aspects of patient comfort. If you can get your own room, it's always a plus. So this new hospital, it allows for maximum amounts of single rooms, and the most that you will have to share with is just one other person in some of the rooms that are double rooms. But the majority of the rooms are single rooms. All of the maternity rooms, for example, are single rooms. All of the spaces, as much as we can, that we are going to be putting children in, will be single rooms with expanded spaces such that the parent can stay in the room with the child. So it's still going to be a single room. So with that aspect, it's a big plus, and it's something that it wouldn't have been possible to modify the current hospital to be able to do that without exceptional amounts of expense. It's going to have an increased capacity for all of the different functions of the hospital. So an increased capacity with regards to the amount of persons that can be seen in the emergency room. That capacity on the norm will be expanded by a factor of 4. But apart from that, it also has the layout advantage such that in the event of something that's a contagious pandemic or some kind of contagion, the spacing can be redesigned without super expense or harassment. And even though that would reduce the total amount of patients that can be seen, it's still an excess compared to what we are currently seeing. So we can adapt to a pandemic without there being any decrease in the quality of care. Apart from that, the opposite can also happen. In the event of an acute mass casualty or major natural disaster, the total arrangement in the emergency room can actually be doubled with regards to its capacity to be able to deal with that. The current hospital, I don't have that freedom or flexibility to be able to do that. We just try the best that we could, but when something is designed for function, it improves everything. And also some aspects of internal things like security and other things, they also improved with the new design of the emergency room. The operating theater will be expanded. We currently have 2 operating rooms in the operating theater. This new facility will have 4 rooms, each room having the ability to do not just general surgery, but also a specified type of subspecialty of surgery. Apart from that, there's going to be the resuscitation room in the emergency room can be converted into a 5th operating theater if needs be, such that if you come in a very bad state, you don't even have to move anywhere. The room itself can be turned into the operating room, and everyone just has to come in and deal with it right then and there. Other hospitals have been able to do that. I wouldn't have been able to do that with the current hospital because it wouldn't have met the aspects of hygienic standards and airflow and a few other things. So apart from those things, it will have an expanded outpatients department. The expanded outpatients department, it's much more than what we currently offer. I would say one of the areas where we have room for improvement is our outpatients department. The staff there work hard. It's not their fault. It's just aspects of overall arrangement and operation that kind of limits what they can do. The true reach that we wish to have, this new facility will enable us to do so, and then some, to a degree much more than what we're doing now. I don't think people will understand it until it's, sorry, I shouldn't say that. People might not appreciate it until it's completed, and when it's completed, they'll understand the new line of thinking that we're going down with regards to the expanded services of the outpatients department. So the radiology department is going to be expanded. It's going to have a PET scan. That's a type of scanning that the oncologists have been asking for. I don't have the ability to put that in the current hospital, but the new hospital will be built for it. That will come a little bit later in the overall stage of things, but the room to be able to house it will be there, and then we'll deal with the final part eventually. It will have more space for ultrasounds, more space for x-rays. It will have its own CT scan. It will have its own MRI space, such that at whatever future point in time when we put the MRI facility in the new hospital, that we can do so seamlessly, because the space is already there to just move and place. It will have a state-of-the-art sterilization department. We don't have an issue with regards to the overall quality of sterility that we produce. But the truth is that we work to get it done using some difficulties that have already been overcome many years ago. So with that in mind, the new facility will be designed to allow for the latest in these things to be used so that the amount of exceptional strain on human effort, it doesn't have to be undertaken anymore. That involves, instead of you having to push your trolley up and down the place with your sterilized items and making sure everything is wrapped up and covered, you actually have what they call dumb waiter,
Right.
that could just take it up and down. It'll be right underneath the theater, so everything just goes up and down, no long moving of things.
Right.
That increases the overall level of sterility, and it does not put all of that strain on the actual worker to have to be carting things up and down the place. And everything else is expanded in terms of the lab services will be streamlined such that the amount of efficiency in the lab, it will be built for the purpose of producing efficiency rather than it being excessive strain on the staff to try to meet the accreditation timeline demands, which they currently try their best with it, and we do get a decent level of service, but this new layout will allow it to be even better than what it is right now, increased an improved layout with regards to our central medical stores, and even the overall layout of the facility being a multi-story design. It decreases.
How tall is it? How high? How many stories?
Oh, sorry. I was going to say, I'm not sure the height is. It's 4 stories in total, but you have to be kind of careful. It's on a bit of a slope, so if you had to count all of the different layers on the slope, it's 4 stories. But the highest individual area in it is about 2 stories, but things go across.
Right.
When it's done, people will be able to see. If you look at the pictures, you'll be able to see that when you count it, it is that way. So from the front, you'll see the 4 stories, but when you enter from the back, you'll see the 2 because of the slope.
Right.
So in terms of the environmental aspects of it, we are working intently with the experts with that to try our hardest to ensure that the rooms, for example, it's a type of geothermal. It's not what people think when they hear geothermal, where you drill into the ground to get the steam. It's a type of geothermal where the heat generated by the room itself can actually be circulated to improve the powering of the room to keep it cool. It's a type of technology that is used in hotter climate places already, and it reduces your overall power bill. The entire roof of the structure will also have solar panels, which can assist with up to 10 to 20% of the total electrical output of the hospital unit. And it's also another one of the reasons why you would notice that the federal cabinet has been moving aggressively to support as much as possible geothermal drilling, just to ensure that we have access to a green energy source. In terms of even the materials being used in the walls, it will be materials to ensure that it does not retain too much heat, because that's usually the main issue with us, retention of heat as well as retention of moisture. And that's why so many buildings develop mold.
Right.
So it's going to be built to reduce the likelihood of the development of mold, which is something that's a big plus. Even down to the windows arrangement, that has been researched much more extensively than I even knew those things are researched. But it was researched very extensively to ensure that as much as possible the patient rooms have views and access to sunlight without it being excessive to cause overheating of the room. So even down to the size of the windows is something that was calculated meticulously with its own set of research. So that would assist with patients just being in more pleasant environments, and at the same time, you don't have the overheating, which is the main thing we're trying to avoid, to reduce the overall power bill. So it really is a green piece of technology, as green as we could make it, piece of technology, and not technology, piece of infrastructure. And it also has technology incorporated into it. That's why you would have seen us, again with the help of the cable, set up our fiber optic net. What's the term for it? The fiber optic network. Well, okay, the fiber optic network, which interlinks the entire country. So not just the hospital, but also all of the health centers, cardiac home, everywhere, interlinked, with the hope of also getting even private areas and pharmacies and private labs, everything interlinked onto the network, so that information about patients can be safely, but also quickly move from place to place in its entirety to get away from all of the papers and having to repeat yourself a million times and those things.
And that speaks to the interlinkages between, such as we mentioned, the health centers. If you're going to direct persons more to utilize the services that are available and would help to expedite them getting treatment for whatever issues at the health centers, should there be a need for them to visit a hospital, then the information can just seamlessly be moved from one institution to another. And that speaks, of course, to the efficiency and part of ensuring that things function a lot more quicker. Yes.
Yeah, in fact, we are working on our electronic records.
Yes, the electronic health records, we have started the process of that. It's going to be an 18-month process to get the entire digitization between the final build-out of the system, installation, training of staff, and then there's even a component in it which will have all of the citizens in the country having the ability to have the app on their phone to be able to access certain aspects of their medical records on their own, as well as to be making bookings for clinic appointments in the government system as well as the health center system, which was why I said the outpatients department needed to improve to allow for, instead of you coming and just waiting, you know for sure you have a 9:15 booking to see, I don't know, endocrinologist or whatever it is, and that it can be done. So all of that is going to be a part of it, as well as everything digitized, including things like pharmacies, such that errors are kept to a minimum, or the doctor hopping to get multiple medications and stuff, that is cut out, since the information will be in the system, and of course rapidity. So you come to the hospital now, eventually it will have cards/codes, so you come to the hospital, you beep your card, everything to do with, especially your most recent visit, it just comes up on the screen. We're just now focused on what did you present currently with. I don't have to ask you everything from name, address, go down the line anymore, because it's all there already.
And
most recent visit.
And there are cost efficiencies as well, for the cost-saving efficiencies for the patients, because if you're dealing with one doctor, for example, the doctor is not around, off island, and you go to another doctor, then you'll have to go to the tests again and all of that. So by having the information data, and it's going to be a hybrid, because, you know, currently our nurses and doctors, they do far too much writing.
Well,
right? It's about 66% of the time, I believe, that they do writing. So we want to put that aside.
In the clinic, it's 80% writing.
Writing. So we want to get rid of that, so it's more clinical work and you get to see more people.
Right. Okay, and so it was hinted at earlier. Very briefly, Dr. Morton, if you could talk to us about plans for the current Joseph N. Franz General Hospital, because there are some persons who feel that the new facility may be not accessible to everyone. And a question again is, as you mentioned, with the additional rooms, will the services, since we already have a CT scan that is in the current hospital, was there going to be an MRI as well too? Will there be additional services in terms of equipment added there, or will they be transferred? Just very quickly, speak to us about that.
Okay, the build-out of the current hospital is of the new hospital rather, is being built to allow for the transfer of machinery from one institution to the other. If the budget allows, we would not mind having more than one, but it takes more than actually more than the budget. Budget and research, if the amount of usage of it would allow for additional machinery to come into play without it causing immense strain, then yes, we can actually split the services amongst the two facilities. But for the bulk of things, it's being designed with the mindset of the transfer of machinery from one to the other, depending on the services that are being provided. So the current hospital, it has multiple uses earmarked for it. So the first use in terms of the rooms that are there, well, actually, let me just begin with things that aren't going anywhere. Some of the auxiliary services are not moving. So that's things like the kitchen and the laundry. Those things are remaining on the current site. That's why we are currently investing in the upgrade and fixing up of those things. Everything that we've been investing in upgrading on the current site, it's because that's something that we intend to continue using in some kind of way. So that's out of the way. So the kitchen and the laundry, it will remain. The kitchen remains where it is with the transporting of the food for the patients, just because it assists with reducing pestilence and other things. So since it helps, it can just go to the new facility to ensure that that's reduced. And the laundry it never really had to be on site. That was just a little plus. So that's not a problem. Where we are doing, and the morgue is also not moving. We're just going to upgrade the morgue. Where we are doing right now, we're upgrading the private ward rooms, but the long-term plan for that area is to have a palliative care facility. That's basically palliative care is end-of-life care. It's not something people like to speak about, but
Yes.
persons that have diagnoses in which it doesn't have a good outcome.
Terminal, right.
Instead of you having to just be home and there's no place for that person to go, that's why the private ward right now is being redone. We'll use it as a private ward when it's finished in about 2.5 months' time. But the long-term goal is you now have a place where persons in that situation where they can go and get that kind of care. The other rooms are going to be utilized for long-term stay. So when we say long-term stay, a lot of the patients that come in on the medical ward in particular, if they have something like a stroke or a heart attack, they can be hospitalized sometimes for quite a number of days or sometimes even weeks. But that takes up a bed that otherwise could be used for someone with a more acute situation. For persons that would have a longer time or path to recovery, instead of rushing them home to then continue as an outpatient, we now would have some beds available such that those persons can slowly and steadily go through the path of long-term recovery. And the other thing would be we're taking a new approach with regards to mental health. The Taiwanese is already helping us to put the framework in place, but we will, and they actually have helped fix up the current psychiatric ward, but we want to ensure that multiple modalities of mental health can be dealt with in the inpatient setting. So
Does that include drug rehabilitation?
We're going to try to aim for everything from drug rehabilitation to schizophrenia, depression, persons on suicide watch, persons with intellectual disability,
Alzheimer's.
and the list goes on. Pardon?
Alzheimer's as well.
Everything, even and Alzheimer's, senility, everything that needs that level of care, we'll be able to have a section, an area for that, so that you can be so that you're not depressed and you're like adjacent to someone that's schizophrenic and being kind of loud and disruptive. And also, it gives us the ability to put into place more of the strong rooms that might be needed for persons that have an acute mental episode. That gives us the ability to do that. The front of the hospital, a lot of it we're going to partner with the persons in community health to expand some of the offerings of what is traditionally the Bastia Health Center, essentially. And it's going to ensure that the same thing, which I mentioned it with St. Peter's already, right? With the polyclinic?
Yes,
the same thing with the polyclinic, that service is extended to the Bastia area via the front part of the hospital, to call it that. A lot of people may be a bit surprised that we're moving to a new location for a hospital, but the standards for accreditation for a hospital are very strict and rigid. For a health center, it's a lot more relaxed, even though they both deliver healthcare. So you'd be surprised that the same building that was a bit, had its own challenges with regards to the hospital, it actually would make for a state-of-the-art, glorious health center, much, much higher than the current standards of any health center. And that's going to be the aim for the front part of the hospital. So multiple uses.
Right. Okay, and we actually want to speak about aspects of medical tourism and so on. So we'll reserve that for the second part.
But what I can say to you is that part of our health promotions drive this year is to have the various leaders. In fact, we're doing some communications training coming up with the leadership team. So they too will be here on your program to talk about Port Health, talk about the community, speak about their areas, talk about PAHO, talk about the surveillance and all of that. So rest assured that you'll see a lot of us.
Right. Okay, so it's just about 1 minute left. Any final comments?
Okay, well, it's been a pleasure working on everything to do with not just the current hospital and the current institutional framework, but also with regards to the new hospital. I'm pleased to have been able to get the opportunity to be leading at this time and to have these ideas, which I've had for a number of years, actually see them become a reality. And I'm going to just make sure that the general public is aware that I'm going to continue working hard to get everything that was mentioned delivered to the people of St. Kitts and Nevis.
Yes. And with that, I want to say thank you very much, Dr. Morton, and the rest of the leadership team that have been driving force behind what has been happening. And we want to continue to stand on our three pillars, the physical health, mental health, social health, and to stand on our mantra, people first, quality always. Thank you very much for having us. We look forward to coming again.
Oh, great. Thank you very much, P.S. Martin and Dr. Morton. And we'd like to thank you, viewers and listeners, for being with us for this edition of InFocus. We trust that you'll join us again next week at the same place, at the same time for another edition. Remember, it's InFocus, your government, your business. I'm Ian Richards.
Join us every Wednesday for InFocus, a weekly talk show produced by the St. Kitts Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.